Welcome to the Spaulding Stroke Research and Recovery Institute's talk series. Today, we're talking about wellness and how you can incorporate the principles of wellness into your life after stroke. Today, we have with us Dr. Elizabeth Frates, who is a physiatrist and the director of the wellness program here at Spaulding Stroke Institute. Dr. Frates is a pioneer in lifestyle medicine, as well as an award-winning teacher at Harvard Medical School and Harvard Extension School. She has dedicated her life to empowering stroke survivors to adopt healthy lifestyles after stroke. She has a wellness coaching company called Wellness Synergy, as well as a program called Paving the Path to Wellness. Thank you for joining us today, Dr. Frates.
Thank you for having me, Antonia. I'm so happy to be here.
So, we would love to know, what is wellness?
So there are a lot of definitions of wellness that are out there. You can look it up in the dictionary, perhaps even Google it. But I'll give you the one I like the best. Wellness is a healthy body, a peaceful mind, and a joyful heart. It's about appreciating the opportunities for the future, the possibilities that exist every day for you to learn and grow. So when we realize wellness is actually a journey, it's not a destination. Wellness is a journey that we're on until we pass. So we want to enjoy that journey day to day. And how we can do that is if we're mindful. We can live in the present moment. And we can think about, what does it mean to have a healthy body? What does it mean to have a peaceful mind? And how about that joyful heart? Am I experiencing joy every day? What are the opportunities I have today? What are the possibilities today for me to experience joy?
So where does wellness fit in the stroke recovery cycle?
Yeah, that's a great question. Because when someone comes into the hospital, to the emergency room, and they cannot move one side of their body, and perhaps they're unable to communicate in their regular way, maybe even they're having trouble understanding what people are saying around them, or having visual difficulties. This is not the time to be thinking about a joyful heart and a peaceful mind. At this time, we really need to get to the biology and to the body, specifically to the brain, and figure out what is causing the blockage in the artery that's creating this stroke, or what's causing the hemorrhage, the bleed that's creating the stroke. So really we need an acute care mentality that is focused on limiting any damage and locating the source so that we can prevent this from happening again and prevent any serious sequelae. So right away, when a person enters the ER, is not the time to be talking about wellness. In fact, during the acute hospital stay, after perhaps a surgery or medication, IV medication has been utilized, whatever needed to get done to stop the stroke is finished, there's still a lot of confusion. There's still shock. There's still great surprise for the patient during that acute care stay. A lot of questions. Will I ever move my left side again? Will I be able to understand people? Will I speak? Will I swallow? Will I eat regular food? A lot of questions exist that require a focus on the recovery itself. So that is not really the time to be introducing wellness. The best time to introduce wellness is when the acute hospitalization is complete, the patient is stabilized, and the patient is now in the rehabilitation setting. At that time, we can start to introduce the concept of the healthy body, peaceful mind, joyful heart. We can start to ask questions of the patient, and see where they are right now in their wellness journey in terms of how are they feeling right now. Very confused, very upset, very disappointed, or hopeful, appreciative that they're at the rehab setting and that they've made it. They've come out of the coma, they've come out of the surgery, and they're doing well. We have to check in with the patient at that time. And then we have to start collaborating, because the providers and the patient are a team. So the therapists, the physicians, the nurses, the social workers, the patient, the family members, the friends, the loved ones, the supporters, are all part of that team. And we need to come together around the patient, for the patient, and start to talk about the wellness journey, which will, again, last a lifetime. You and I are on wellness journeys. We haven't suffered strokes. We're all on wellness journeys. The stroke survivor may have a different type of journey now, but the wellness will continue on. And here at Spaulding, we talk about in the inpatient side, but then we really emphasize it in the outpatient side. So with our programming, patients who have suffered a stroke and have been in recovery weeks, they can join our program. We've had patients who are months post the acute event, and even years, 10 years after a stroke, we've had survivors and their loved ones come to our wellness groups and get a lot out of it. Remember, in the wellness journey, there's opportunities and possibilities each day to learn and grow.
So you seem very passionate about empowering stroke survivors. What has motivated you to dedicate your life to stroke survivors living healthier lives?
Well, it's multifactorial. I am fascinated with the brain. I am fascinated with the blood vessels, with cerebral tissue, also with mood, how neurotransmitters affect mood. But I think the passion and the reason that I dedicate so much of my time to stroke survivors and to helping people adopt healthy lifestyles is because of my own history, my family history. My father suffered a stroke when he was 52 and I was 18. So this changed the trajectory of my life, of my career. I was going to go into business actually and join him in his business, but everything changed after the stroke. As my dad always said, the stroke was a gift in disguise, because I watched him move from overweight, overworked, overstressed, to not being able to move the left side of his body, to then recovering fully from the stroke, except fine motor movement in that left hand. As we know, that's tough to come back, but the only real limitation he had was manipulating change, coins, with his left hand. So I watched him work very hard with physical therapy, occupational therapy, so that he could get back to functioning at his optimal level post-stroke. And then make drastic lifestyle changes. Back in the 80s, which is when this occurred, there really wasn't lifestyle medicine per se. There were some pioneers, Nathan Pritikin and Dr. Whitaker, who set up facilities, inpatient facilities, where patients could come to learn about heart disease and stroke. They could learn about healthy diets. And by the way, the diets that were recommended back then in the 80s are the same ones we recommend today, which are fruits and vegetables, whole grains, and healthy proteins. The Mediterranean diet that we're familiar with now. Wasn't called that back then, but that was the heart healthy diet, and it's still similar today. And then I watched him change his movement pattern so that he exercised regularly, which, by the way, not only changed his body, but helped with the peaceful mind. And then how he spent more time with my mom and with his relationships, family, friends, kids, and how those flourished and blossomed, so that that joyful heart, he could really experience it. So I watched him, and it changed me from an economics major in college into a biology and psychology major. And it is the fact that I didn't have a stroke, but I had the next best thing, if we can say that. I went through the entire process with someone that I adored, admired, and loved so much. So I really went through it, I feel, as a loved one, every step of the way with him. And in fact, I mimicked his recovery process in terms of his lifestyle. So since I was 18, I've been trying desperately to eat healthy foods, to keep moving, to have stress reduction techniques that work for me, to be connected to other people in my life, my family, my friends, and to monitor my energy levels. So that is the real passion.
Thank you for sharing that with us.
You're welcome.
What are the unique challenges for stroke survivors living a healthy life or trying to adopt a healthy life?
The interesting, fascinating thing about stroke is that every stroke is unique. Every patient has their own story. Every brain has its own story. And the recoveries are unique. With a broken leg, a broken bone, it's localized, pretty predictable, pretty standard care, affects the bone, pretty much only the bone, muscular tissues around, but we really have a set way of treating that broken bone, and then expectations for recovery that are pretty standard. And when we get to stroke, it's the brain. The brain controls the whole body. So we could have somebody working on their left hand function, as my dad did after his stroke, or somebody working to communicate and have more fluent speech or swallow. Or maybe it's a visual spatial problem that they're working on. It's different for every survivor. The other thing about the stroke that can be challenging is that it will affect the neurotransmitters in our brain, meaning serotonin levels might be lower. Serotonin is associated with our mood. So there's a higher risk for sadness, for depression that can set in after the stroke. Importantly with stroke, many times we have mobility challenges. Not always, but many times. So that can lead to sedentary behavior, if you know what I mean, sitting.
Yeah.
A lot of sitting or lying down. Now, this is a challenge for stroke survivors because we need them to be moving, as you and I need to be moving. We all need to be moving. But one of the challenges with stroke survivors is that they may not be comfortable moving, they may have pain, and it also may be difficult to move. So they may need assistance. So that may leave them sedentary for longer, which puts them at higher risk for disease and a second stroke. So we need to be aware of that unique challenge.
It's good that you talked about that. I know you've written a book in collaboration with Dr. Joel Stein and Dr. Julie Silver.
Yes.
Called Life After Stroke, The Guide to Recovering Your Health and Preventing Another Stroke. So what are the top 3 healthy habits that you would recommend people to adopt, or actually stroke survivors to adopt today?
Just 3, top 3. Antonia, challenging me, because I'd like to give you 20. But okay, 3. Okay, then I'm going to say more. It's all going to be more. More plants, more movement, more fun.
I like that one.
So what does that mean? Those are pretty broad. That's how I can get more than 3 in a way. But we're sticking with 3. More plants, more vegetables, more fruits, more brown rice, quinoa, plants, nuts, seeds. Why? Because there are phytonutrients in these vegetables, in these fruits. There are antioxidants available in the fruit, in the vegetable, such that what Hippocrates said many years ago, right? Let food be thy medicine, can be true. Because there are nutrients in those fruits and vegetables, in the plants, that help us to recover, one, and also to live at our optimal level, to have energy. We need magnesium for energy. Nuts have magnesium. We need calcium. We can get this in our vegetables. And in iron, we can get this also in our vegetables, in our plants. So we need these things to fully function. And our protein, we can get these from beans. So more plants, more vegetables in particular, and fruits. Now I said more movement. It's really important to try to get to the guidelines for exercise, which are to accumulate 150 minutes of moderate physical activity in a week. Now moderate intensity, what does that mean? So moderate intensity means I'm walking or moving, and I'm doing it at a pace in which I can talk with you, but I cannot sing. So I'm winded a little bit. Now that's moderate. If I'm at low intensity, that means I can sing and talk. If I cannot sing and I cannot talk, I'm at vigorous. So we're looking for 150 minutes of moderate intensity physical activity in the week. The beautiful thing about accumulation, using that term for our guidelines, is that it opens it up to a variety of schedules. We can be flexible. You can walk 10 minutes in the morning, 10 minutes after lunch, 10 minutes after dinner, if you like, and accumulate 30 minutes in that day, and do that 5 days a week. 5 times 30, you will achieve the 150 minutes. Or if you only have time to exercise in one block in the day at lunchtime, you could do your full 30 minutes then. Or you could do 20 minutes one day, 40 minutes a different day. You can break it up however works for you. And by the way, can you do 5 minutes? Yes. You can do 5 minutes in the morning, 5 minutes at night, and do 10 minutes that day. More is better. Some is better than none. That's the thing to remember. And sit less goes with move more. You might have heard sitting is the new smoking.
Yes.
Because again, sedentary behavior, a lot of sitting, is a risk factor for disease. So even standing more is an important goal. So if you're sitting, after 1 hour, we recommend you stand. Get up, walk around a little bit, move your limbs, even do sit to stands, do a few of these after an hour if you've just been sitting for 1 hour. And focusing on that, move more, is really important. Then let's get to that third one. More fun. Okay, what do I mean by that? I'm talking about connecting with family and friends, with a community group, perhaps peers, perhaps other stroke survivors. Connecting with others and trying to find opportunities for joy in the day. I mention this particularly with stroke survivors because sometimes after the stroke, we don't feel ourselves, we're not quite accepting of ourselves, We may have limitations we didn't have before, so we may isolate. We may stay at home and not make it to that birthday party or that baseball game with our friends because we don't feel comfortable. But I would encourage stroke survivors and loved ones and caregivers of stroke survivors to make opportunities for the stroke survivor to get out and to enjoy family and friends and events. Because loneliness is, in fact, a risk factor for disease, for heart disease. Feeling isolated and lonely. And stroke can put us in a position where we are isolated and lonely. We need to avoid that. So find more fun by connecting with more friends and family and finding opportunities to be out and about with other human beings or a dog. If you have a dog that you love, get out with that dog and walk that dog. Because, by the way, when you walk the dog, you know what happens. You run into other people that are walking a dog, or you run into other people that want to pet your dog. So you end up having this human connection, this interaction that we all need. We need human interaction. And so when we have suffered a stroke, we must be mindful that connecting with others is important. And also, we are worthy. We are the same person we were before the stroke. We may appear a little bit different. Our abilities may be slightly limited, but that does not change who we are. Our essence is the same. So we want to bring that forward. So more plants, move more fun.
That's perfect, 'cause that leads us into the next question. Would you mind talking a little bit about your program, Paving the Path, the 12-Step Wellness Program?
Yes, thank you for the opportunity to do that. I love to talk about it. Notice I had 12 steps. You asked me for 3 things. I tried to do my best with that. But, so yes, the wellness program. You know, I'm glad you asked me the definition of wellness earlier, because a lot of people think it's exercise more, eat less.
Yeah.
Done. Eat less. Well, it's not just that. It's not just about those things. It actually incorporates body, mind, and spirit. So for the body, yes, we're going to talk about exercise, nutrition, and something very, very important, sleep. And for stroke survivors, this can be a challenge due to pain or just perhaps the neurotransmitter issues and depression that we may be feeling. So these 3 things for the body, exercise, nutrition, sleep, very important. But we're also going to get into the mind in this wellness program. We're going to talk about stress resiliency. We're going to talk about ways that you can reduce stress in the moment, and also things you can do so that your sympathetic tone, your stress response is downgraded, so that in the day you're a little bit more even keel. Through mindfulness-based stress reduction, through routine exercise, these things will help to keep us at a lower level of stress. But we'll also talk about in the moment stress and how deep breathing, simple techniques like 4-7-8 breathing. Breathe in for 4, hold for 7, breathe out for 8. Things like 4-7-8 breathing, these simple techniques we can utilize that will bring down our stress levels. So bring down the sympathetic, turn on the parasympathetic. Sympathetic is fight or flight, parasympathetic, rest and digest. So talk about that, because for the mind, the stress resiliency is so important. Also for the mind is attitude. Is this a gift in disguise, this health setback I've just had? How do I see it that way? Attitude, positivity, optimism. Where's my strength? Spaulding's motto, find your strength. Stroke and this program, wellness program, it's about finding your strength. Your yes, physical strength, but your mental strength too. using your strengths so that you can have a healthy body, peaceful mind, joyful heart. Then a gratitude attitude of gratitude. So important. And how do we adopt that and sustain it? We talk about that. And then for the mind, we also talk about time outs. What do I mean? Pauses. Empowerment moments. Time when we are just sitting, being, Don't just sit there, do something. Everyone says, well, sometimes we do need to sit in the moment and just embrace the moment and be mindful in the moment. And how do you do that? How do you actually take a time out? How about when we're having a conversation, not that you and I, Antonia, would ever have a conversation like this, but if we had a difficult conversation, we're having a difficult conversation with a loved one, it's not going well, right? We can just take a time out. Bill Belichick, right? They use them. We think about timeouts with the sports all the time, and that's how they regroup, reorganize, empower themselves to go back out on that field and tackle the next situation. We have to do that ourselves, for ourselves. Take timeouts. And then the joyful heart. And this is a piece that's often missed in health programs or when we're talking about stroke recovery. People forget about this joyful heart and they don't know how to get to it. Social connection is a huge piece. Being with your family and friends, having high quality connections, cultivating those. Then it's a sense of purpose. Now our sense of purpose changes in time. But the way your sense of purpose was probably different 10 years ago than it is now. Different before kids, after kids, when we're grandparents, different during school, after school, different pre-stroke, post-stroke. Our sense of purpose can change. But having a sense of purpose, a reason for being, a reason for getting up, helps us. In fact, there's some research that shows having a sense of purpose increases your longevity by 7 years. So we work on that in this program, sense of purpose. And then we talk about energy management. It's not just about how many coffees you can drink. No, it's about what brings you natural energy. How can being outside in nature, taking a walk outside, actually increase your energy levels? What else increases your energy? Can you identify friends that you see and immediately your spirits are lifted? Your energy level comes up with those particular friends. Are there special foods, like we mentioned, nuts, that have magnesium in them that naturally will help us have energy? We talk about energy levels. So we need that for a joyful heart. And then another really important area, purpose, energy, social connection, that's for the joyful heart. But what about action? We're talking a lot about different things that we need to do. We have evidence behind them. But Antonia, now what do we do? Let's do something. And that's what this group does, this wellness group does. Action. Setting goals. Investigating what's working right. What's working well. Being curious. Should I look for a swim class for stroke survivors? Should I try that? Yoga for stroke survivors? Maybe. Maybe I will try that kale after all. But investigating and then using a variety of exercises. We need strengthening, we need aerobic, we also need balance training. A variety of spices in our food to make those vegetables taste really good. So we experiment with a variety. But in order to get action going and sustain action, we need to be able to set goals, have an open mind, a growth mindset, to try new things, to investigate, and to learn from these investigations. And then to be willing to take on a variety of approaches. For stress management, maybe you have never meditated before and you think it's just something that people are talking about. There's no real science behind it. Well, let's talk about the science behind meditation. Let's talk about the variety of meditation techniques. You don't have to be on a purple pill all propped up, sitting and umming. You don't have to be like that to be meditating. So what else can we do in terms of finding that peaceful mind, that place of meditation. So those are the 12 steps. We work with the body, the mind, the spirit, and then we also take action.
Thank you so much for joining us today, Dr. Frates. I feel like we've learned so much. Top 3 things that we learned: more movement, more fun, and more vegetables. If you want to learn more about wellness, visit our website or email us. Thank you for joining us.